When we talk about asset optimization, we're really talking about establishing processes and enabling technologies that can allow you to have the right piece of equipment available in the right condition for the right patient at the right time. So it becomes a little bit more complicated when you're talking about mobile assets because they tend to be smaller, they're easier to hide, it's easier to circumvent the process. We've worked with a number of clients recently around this space for mobile assets in particular, and we focused a lot on IV pumps as one of the higher cost mobile assets that generally has a lot more inventory in the system, in the healthcare system as a whole, that we believe has a lot of opportunity. And what we've seen with clients is where they think they're really utilizing their assets well, when we get underneath it, we find that their utilization of their pumps can range in the 40 to 50% range, where with the right process redesign, you can drive that into the 80 and 90% ranges. Some of the examples of things that you might see in your own hospital to look for are all the pumps that are in rooms really in use? We've seen that typically in most hospitals we've gone into that as many as a quarter or more of the pumps that are in a room are not in use. So they're obviously not being utilized. Nurses will tend, when they don't trust the process, to hoard the pumps, if you will, so that they're sure that when they have a new order for a new medication for a patient, that pump is available. And so they'll hide them, and that creates the need for a greater inventory. You know, another big component of this is really the quality aspect to it. And so in some of our clients, we've seen that they've established processes to clean pumps either in central sterile or in a decentralized mode, but through a particular process. And a client recently that we were working with that had a process that was supposed to take every pump through central sterile in between each patient, we found that when we really got underneath it, only about 9% of the pumps ever actually made it back into central sterile in between patients. Doesn't necessarily mean that they weren't being cleaned in some fashion, but they clearly weren't following a standard process to ensure that they were appropriately cleaned. So that could be a big deal. In another client, we found that less than half of the time did the pumps actually even make it to a soiled utility in between patients. So as you're thinking about asset optimization in your own facility, some of the questions you might ask yourself are, do you know what your true utilization is for each piece of equipment? Not a perceived utilization, but that actual utilization. Do you have par levels in units and floors that are established based on actual demand, not the perceived need of nurses and staff to have more pumps available than they actually may need at any point in time? Do you have visibility to where your mobile assets are at any point in time and what status they're in, and ability to receive exception notifications when that equipment doesn't follow the standard process?